Hello friends, it's often difficult to choose the right implant for your patient. With multiple implants in the market and multiple companies promoting their implants, it's challenging for the surgeon to figure out what is the right implant for the patient. It's very important for us as scientific people to choose the right implant based on long-term evidence, registry data, and published evidence. So this is a video in which we'll demonstrate various types of knees with absolutely no intention to promote any particular type of knee. We'll highlight the strengths and weaknesses of every knee design with respect to our patients' needs, sizes, shapes, and patellar issues. So we'll base our study on published data, long-term registry data, and other published evidence, along with our own experience of having used all these types of knees in patients over the last 10 years. So let's start with the Nephew knee, which is the PFC Sigma, and has been used in our market for the last 25 years. Excellent performance, but with a few issues. So if you look at the design of PFC, we're talking of the posterior stabilized design. The box is very high and the box ratio is too long, and the reason is that you can put a stem in the femur. There is a provision of putting a stem in the femur, and that is why the box is longer or taller as compared to other knee designs, and this leads to higher incidence of patellar clunk and painful crepitus, as is published in many papers. Also, there is a limitation of having only 5 sizes, and you can downsize your tibia to only 1. That is, if you have a 3 femur, you can only put a 2.5 tibia, and in Indians, especially ladies, the tibia really comes down very drastically, and if you want to do a 1.5 on a 3 femur, you cannot do that, in spite of the fact that your tibia may overhang posterolaterally, and that's a little compromise. The reference system is posterior, so essentially what that means is that this will move, this arm will move, and it will size your femur, but you will put your pins here based on the posterior condyles, and you will reference this as per posterior condyles. Now if you downsize based on these 2 reference pins, you are tending to notch. The original AP cutting jigs were very big, but now we have better instruments. So suppose you have a posterior reference of this size 3 and you think you're notching, you can go up -2, or you think you're proud and you will overstuff the anterior compartment, you will come down and you will cut less of the posterior condyles. So it's very important to understand your instruments and what they are doing. So this AP cutting jig with +2, -2 going up and down is pretty useful, because that will help you titrate your flexion gap without notching anteriorly or becoming proud anteriorly. So that's the key. So the advantages, I believe, of the Nephew system are that you can put a rod in the femur, though the cases for those are very less. You can put a rod in the primary tibia. That's an advantage, definitely. The advantage is that on the AP cutting block, you can go 2 up and 2 down, depending how you want to titrate your flexion gap and how you are anteriorly. The disadvantage is the higher incidence of patellar clunk, crepitus, and painful crepitus because of the taller box. But overall, good long-term data in the registries. Now let's come to the second knee, which is the Zimmer's LPS Next Gen design. Again, a very good design, and it has got very good long-term data in Australian registry. In fact, it's one of the best performing knees at 15-year follow-up in the Australian registry. Now, let's come to this design. Very excellent small box, very good patellar tracking, And Zimmer, in fact, is one knee in which the patellar problems are very less. There was a study published in Clinical Orthopedics and Related Research where they compared the patellar symptoms of all the designs, and Zimmer had the least patellar problems because of an excellent tracking mechanism and a very good Q angle. Now, this is anterior referencing. Now, what that means is that you will size here and you will rotate 3 or 5 degrees, whatever you want, but you will put your pins here, and this moves with the anterior mechanism. So if you downsize, you will not notch, but you will cut more of posterior condyles. So what that means is that you will put your holes here, and once you put your block there, in these 2 holes, you can turn it slightly medial lateral. That's one thing. Second thing is that the size of the AP cutting block is same as the size of the component. So that's an additional thing, and you can really lateralize. You can put a finger and see your anterior reference, and if you want to come down or up, that's not possible in this. So you really need to make your holes. Again, there is no way to come up and down once you're committed. Another disadvantage is that you make your primary holes at the time of AP cutting block. And once you take your trial and you want to downsize, you cannot do that because you're already committed with the holes. So that's a slight disadvantage, but not that much. If you want to downsize in an anterior referencing system, you will not do anything anteriorly, so your block will remain the same place as far as your anterior reference is concerned, but you will cut more posteriorly. The tibial sizes are also pretty good, and you can go 2 up and 2 down, so that's an advantage over Nephew, in which you can only go 1 up and 1 down. Overall, a very good design both for CR and PS, and the advantage is a very low incidence of patellar clunk and painful patellar crepitus. Now let's go to the Biomed Design. Biomed design is the vanguard. And the advantages over Nephew and Zimmer, which have 5 or 6 sizes, here we have 10 sizes. And sizes are as per the millimeters in AP. So it makes it very simple, 55, 57.5, 60 and up to 80. So this system is again a posterior referencing. Another advantage is that you can dial your rotation from 0 to 1 to 2 to 3. It's not fixed 3 or 5 degrees. And you can really put a particular instrument here to see that you are parallel to the interepicondylar axis, and the size difference is only 2 millimeters, 2.5 millimeters. So that's really an advantage. You have 10 femoral sizes, and in case you want to downsize here, we have to remember that it will notch. So there is a small slot here, and with this screwdriver, if you are in between sizes, so suppose you are in between 65 and 67.5, you can take this little up, come on 65 and then put your pins, and you will be absolutely fine. And because the difference is only 2 millimeters between components, the incidence of notching or any that kind of problem on the anterior surface is minimal. Nevertheless, you have this beautiful small instrument. In case you have your pin slots here and you want to go up, you think you're notching, you can go up, or you want to come down, you think you're proud, you can also come down, so that you're flush with the anterior surface, and posteriorly you can titrate your flexion gap. So again, hypothetically, suppose you are between 65 and 67.5 and you put your pins as per 67.5 and you want to then come to 65, you use this instrument, come down 2 millimeters so that you are flush with the anterior surface and you are not cutting too much posteriorly. And posterior medial, we should cut about 9 or 10 millimeters. What is the size of the thickness of the distal femur condyle? We should cut that much posterior medial. That balances our flexion and extension gap, and we cut the tibia, then the tibia then balances both the gaps equally. So it's important to reference your posterior medial condyle, which should be about anywhere between 9-10 mm, which is the same as the thickness of your distal femur cut. Another advantage of Biomed is that you have this thin patella, which is only 6.2 millimeters. So when you have a very thin 6.2 millimeter patella, we can in thinner patella, which is, so you can see here that the thickness is only 6 millimeters. So in thin patellas, where the overall thickness is 20 millimeters, you resect 6-7 millimeters and replace without over resecting or with the risk of overstuffing. So with great advantage for Indian female patients with thin patella, you can resurface patella even in patella thickness less than 20 millimeters. So that's the advantage of Biomed. Let's come to the Legion knee, which is the Smith-Nephew knee. Great design, and the biggest advantage I feel is that the referencing jig here is both anterior and posterior reference. So what you can do here is that whichever way you want to reference, you can reference. So this is for anterior reference and this is for posterior reference. So in case you are absolutely accurate in size, suppose you are coming at 5, you can put your posterior reference and you will be fine. But if you are between, let's say, 6 and 7, you can reference. So you are between 6 and 7, you can reference anteriorly. Then you can put a 6 block, see how much you are cutting posteriorly. If you are cutting more, you can upsize to 7. And since you are referenced anteriorly, you will be same on the anterior surface. So you will not notch or you will not be proud. So if you are exact on the same side, you can reference posterior because you know you are not going to notch. But if you are in between sizes, you can reference anteriorly, put both the blocks and see how much are you cutting posteriorly. Because with anterior reference, you will be same on the anterior surface, absolutely flush with the anterior surface of the femur. But posteriorly, you will see how much you are cutting and you can choose the size which cuts 9 or 10 millimeters. Another advantage is that if you want to go 2 up or 2 down, you can use the similar instrument that we had in Biomed to go 2 up and 2 down. And you are anterior referencing. Now you want to go 2 up, you can go 2 up. You want to come 2 down, you can come 2 down. See how you are on the anterior surface, which should absolutely be flush, and you should not be notching or you should not be proud. That's the important thing. Tibia is an advantage because it's anatomical and the AP dimension of the lateral tibial condyle is smaller than the medial. So this is an anatomical tibia, and that's an advantage because you are not overhanging posterolaterally even when you externally rotate. So that's a great advantage. The preparation is also very simple and you're not losing too much bone on the tibial preparation. Now let's go to another design, that's the Max, and the design of Max was published based on a published paper by Vaidya et al. In Indian Journal of Orthopedics, depending on the size of our own Indian patients. So size starts from 52, the smallest size, that is the size A, and it goes from A, B, C, D, E, F. So you have more sizes, a smaller box. The reference is again anterior. So you reference anteriorly and you can do either 3 or 5 degree external rotation. And if you are in between sizes, so you're referencing anteriorly. So if you choose 2 sizes, in between sizes, you can see how much you're cutting posteriorly, because anteriorly again you will be the same. So you're putting your pins here. Say you are between E and F, you can put E. You can see how much you're cutting posteriorly. If you're cutting too much, you can go to F. Anteriorly, you will be the same because it's anterior reference. It's a good design. Again, a very, very deep patellar groove. Patellar tracking is good. And even without patella resurfacing, especially in Indian patients with thin patella, even without patella resurfacing, the results have been good. It's been in use for quite some many years, and we are seeing some early published evidence with this design as well in Indian Journal of Orthopedics, also in one more Journal of Arthroplasty. There was a recent paper on 5 to 8 year results of this design. Now let's come to one more knee, which is the Ascalip knee, Columbus knee. And this design is, again, you have narrow in each size, just like the Smith-Nephew where you have narrow. So in Smith-Nephew and Ascalip, you have narrow in both the designs. So if you want to downsize, just because of ML overhang, you don't need to do that. You can take a narrow size. In Indian patients, the ML width of the femur is smaller. And sometimes we think we are overhanging, and for that, to prevent overhang, we downsize. But when we downsize, we cut more of posterior femur condyle. So here we don't need to downsize, we only need to take a narrow and will not do any ML overhang. The reference is again anterior. As you can see that these two holes move with the anterior reference. So this is an anterior reference jig. And again, if you want to upsize or downsize, you will not cut more anteriorly. You're sharp on the anterior surface and you will titrate your flexion gap. The AP cutting block again has a +2 -2 slot. So if you're proud, you can come down. If you're notching, you can come up. So this is a great advantage of some of these recent designs, especially Smith Nephew and Ascalop, that you can come up and down on the AP cutting block. The tibia has also many sizes. It's got 2 in each tibia size. So you can reference your tibia according to the AP and the ML width of the femur. Now, so this is the advantage. One more design, that's the Striker NRG. That's a single radius design. Very good long-term results. The only problem is that in Indian patients, because it's a single radius design, the width of each femur is very big. So sometimes in Indian ladies, you see overhang with the Striker NRG design. But it's an advantage because it's single radius. It does not have mid-flexion instability, and that's also proven in a few papers. Very good stability overall, but because it's wider in ML width, sometimes it can cause an overhang. So friends, just to summarize this once again, let's go to each knee quickly, and this is a summary. So PFC, good long-term results, higher box, more patellar crepitus. Posterior reference, disadvantage is only you can downsize one on femur and tibia. Zimmer, good design, very good patellofemoral tracking, minimal patellar symptoms, anterior referencing. You commit on the lug holes initially at the time of putting your AP jig. That's a slight disadvantage, but otherwise very good long-term results. Only 6 sizes, but when you're downsizing between E and F, you have to be careful because you'll be cutting quite a bit of posterior medial condyle or posterior condyles. Biomed, 10 sizes. Advantage in terms of sizes, posterior reference, any degree of external rotation, not just 3 and 5, you can reference from 0 to 10 depending on your interepicondylar axis. Ability to go 2 up and 2 down depending on whether you want to reference. You want to come 2 up and 2 down but be flush with the anterior surface, and you can titrate your flexion gap. Smith Nephew, great design. Your ability to come down to narrow helps you prevent downsizing, because in Indian patients sometimes we have ML overhang and we downsize to prevent ML overhang, thus cutting more posterior medial condyles. That's the advantage in Smith Nephew, that you can take a narrow size. Anatomical tibia, good design. The AP cutting jig is a great one because you can use both anterior and posterior reference. Then max, again sizes according to our own patients. Good early long-term results. Jig is anterior reference. Again, you won't notch or become overproud on the anterior surface depending on your correct sizing. And finally, Ascalop, more sizes, again a narrow design, anterior reference, and you can go plus up or -2 on the AP jig as well. So you're sure that you're flush with the anterior surface and you can titrate your flexion gap. So friends, I hope this small video will be useful to you in choosing the right knee for your patient. Let me reiterate, this is not to promote any one design, but this is to give you the right facts, the scientific evidence of how each knee has been performing over a period of last 15 to 20 years, and also based on my experience of the use of each of these knee. Thank you very much.